Um, so how long do pandemics normally last? If you think of past pandemics, like, I don't know, the Plague in the 1300s
Yeah.
or the Spanish flu, do they give us a sense of what we should be expecting here, or are they just really different experiences?
Yeah. So the answer is both yes and no. They do give us some sense, and also they don't give us a whole lot of information. Um, uh, First, I'll explain why they do give us some sense. So the 1918 flu pandemic, worldwide flu pandemic, was the most recent pandemic that is similar to this. We've had other pandemics. There was a 2009 flu pandemic, but that was very scary, but the effects of it seem to be much less serious than this one, than with this pandemic. So with the 1918 flu pandemic, what we can see is how long it took for a new disease, because that was a strain of the flu that had not been around, how long it takes for that to essentially go through the world's population, and then die out. And that took more than a year in that case. The reason why we can't necessarily draw a lot of conclusions from that is because the world we live in today is so dramatically different from the world in 1918. Immunology, so our ability to study and create vaccines, was in its absolute infancy. So there were some vaccines, but they were pretty crude vaccines. So where we are technologically, scientifically, medically is so dramatically different from where we were in 1918. On the flip side, there are also ways in which our world is much more connected than 1918. And that could make it in some ways harder to stop. Air travel was obviously not occurring in 1918. People tended to be in their communities. And so it was easier in some cases to have quarantine efforts that would limit it to a specific region. So I think the key thing here is that our technology and our medical research capabilities have advanced, but so have a lot of other things in our society that in some ways will make this easier to fight and in some ways could make it trickier to fight. Just one other example, because 1918, on the one hand, doesn't seem like it was that long ago, but essentially it was before people had refrigerators in their homes. So, and now we can freeze food, we can store food. That makes it a little bit easier for us to isolate ourselves in our homes, which was something that was much more difficult to do in 1918.
Yeah, that's really helpful to hear. You mentioned in there that the disease disappeared or died. Can you talk a little bit more about that? Like, what does it mean when a disease disappears? And is that what we expect will happen with this disease, or do we not know yet?
So a disease can disappear in a couple of ways. One way it can disappear is by total eradication. So meaning that there are no cases of the disease anywhere in the world. And when that's the case, then it can't be spread. That we have eradicated a disease called smallpox, which was one of the deadliest diseases known to humans. And we did that through a smallpox vaccine. Another way a disease can not be completely eradicated, but can essentially stop transmission is through a concept called herd immunity. And that's what we try to achieve with things like measles. So what herd immunity means is measles, as I mentioned earlier, is one of the most, if not the most infectious disease known to humankind. So if there's one person in a room with measles and 10 people without it, 9 of those other people will get infected if they don't have immunity. If 9 of those people are all vaccinated or all have immunity against measles, that means that one person can have measles and there's very little chance of it spreading. And so when you have herd immunity in an area or in a community, even if someone is infected, they're not going to be able to spread it to other people. And so when they get better, then the disease will disappear. That has mostly been the case in the United States with measles. Unfortunately, there are people who aren't vaccinating, and that has allowed more people to get measles, but that's one way that you can stop transmission. So with this disease, what we could see is that enough people in the population get immunity either through being infected or through a vaccine so that it is no longer able to spread. That would be the most straightforward way for it to stop. But then also there's a lot that we still don't completely understand about pandemics, including in some cases why they end. And as amazing as it sort of sounds, given all of our knowledge and everything that we know and everything science is able to do, there is still a fair amount that we don't know about pandemics. But we can usually predict, in this case, I think that the longest scenario that people are really thinking about would be a year or maybe a year and a half. But that would not be a year or a year and a half when the type of extreme measures that are in place now would need to be in effect.
When would they, or I guess I have two questions. One is, how are people, like scientists, making those predictions? What are they using to make those predictions? And then how would we know when it would be a good time to stop the extreme measures?
So again, one of the tricky things, well, so there are a couple of ways that scientists are making those predictions. One is by studying the course of this disease. So for instance, in China, we've already seen cases peak and then drop very dramatically. Either a day or two ago, was the first time since the outbreak started that in China there were no new cases caused by infection, which is incredible given at the rate that the disease was spreading. So one thing that scientists can do to try and predict what's going to happen is look at different areas of the world in which the outbreak started earlier, study its progression, and study what was put in place to help stop the transmission. So China put in place really, really strict controls over people's movement and isolation. We can also look to South Korea, which has had much lower rates of infection than a lot of countries in the world, largely through, oh, my computer just said it's gonna try and go to sleep, sorry. Cancel. Okay. We can also look to South Korea, which has had much lower rates of infection, largely through a very, very aggressive testing program that included drive-by testing very early on. So scientists are looking at what has happened in other countries, and then using that information both to plan their response in countries that have not been hit as hard yet, and also to try and predict what's going to happen over a longer term. And they also look at past pandemics, like the 2009 flu pandemic, that again was not nearly as dangerous as this one, at the 1918 flu pandemic. So there are a number of different ways that researchers go about trying to essentially predict the future. And then what they do is, instead of relying on one method, instead of saying, okay, we're going to look at 1918 or 2009 and base our conclusions on that, what they do is they take all of the information they're getting from looking at other countries right now, from running simulations, from looking at history, and then pool all of that information together and use that to try and model what is going to happen.
Can you speak a little bit more about the power of modeling and how it helps us figure out the situation we're in or future situations?
Sure. So what modeling is really important, especially in a situation like this, because it not only helps predict what might happen, but it helps us prepare. So right now, the Centers for Disease Control and health boards and public health officials are running models, a number of different models all at the same time. So they're running models based on what would happen in this country if 40% of the population is infected. What would happen in this country if 30% of the people are infected, or 20%? And then also running models of what would happen if 40% of people were infected in the next month versus what would happen if 40% of people were infected in the next year. And the reason why that's so important is because that will allow hospitals and healthcare systems to plan. Because if 40% of the people were infected in the next month, that would be a big problem for hospitals because we just don't have enough hospital beds to treat that many people at once. That's one of the reasons why this social distancing is so important. Because what it's trying to do is flatten out the rate of infection so that instead of a huge number of people being infected all at once, even if the same number of people will be infected overall, having it occur over a much longer time frame so people can get treated in the hospital and then come out and open up room for other people. So that's one of the main reasons why modeling is so important. And it also allows us to do things like start to understand where we might need to plan for extra help. So what type of supplies hospitals are going to need more of than they have, and then put measures in place to make sure that they can get those supplies.